Good morning, everyone. Good morning. If we can settle down, I'd like to introduce our speaker this morning. Good morning. I have the pleasure this morning of introducing Andrea Morgia. She is a colleague of mine at the county. She is the Director of Mental Health and Crisis Services for Adults in Onondaga County. The county has been building a system of care to address the needs of people in the community and our people with mental health and mental health and crisis services. So I'm going to turn it over to her. She is so well versed in everything, and I just sit in awe and listen to her. So I'm going to let her take over.
Thanks everyone. I'm just going to raise this a little bit. I'm going to start by saying go Bills. I don't know if there's any Bills fans in the houses. It's probably a dangerous thing to say, but that's okay. I'll start there. So thanks for having me. I've never been to Plymouth. The service was lovely, so thanks. Hopefully I can make it back and share some Sundays with you all. Like Kirsten said, I work for actually a company called CCSI, but we're contracted with Onondaga County. And we work over there at the Civic Center on the 8th floor. And actually Kirsten sits right outside my office, so she hears me in there jabbering around all day long on meetings and stuff. So I just want to start by talking a little bit about some of the programs that are in our adult system of care, and then I'm going to move to crisis services. One of the things that we probably are all really familiar with is the amount of unhoused individuals in our community. And one of the programs that I oversee is a SPOA program, and that is our single point of access. So through our programming, people with severe mental illness are housed. And it's a very, very busy program. I think we have probably 10 to 15 applications a week for people who come in who need housing, supportive housing typically, need some sort of case management, and don't have the services and things they need. One of the problems is that we don't have the housing for them. And so currently right now we have very, very long wait lists. We have lots of people that are in shelter as a result. And so it's been quite a struggle. It's not that we don't have the people to support those people, we just don't have the places to put them, unfortunately. And so I can offer to talk more about SPOA. You all are welcome to do a SPOA application on behalf of someone else. It's a bit of an involved application because we need records from psychiatric care because there does need to be some sort of severe mental illness. So there's that program. We also have an outreach program. Again, I can also share with Kirsten how you all can actually refer individuals to that program. We have a great team that serve about 15 to 20 people on their caseload. They work on a system which is relentless pursuit of engagement, meaning these are the people that are really, really hard to engage. Some of them are unhoused, some of them are in shelter, some of them don't want to be housed. You know, that's one of the other tough things is that we can't force people to go into shelter or housing for lots of different reasons. But my outreach team works really, really hard to get people connected to services, to help them do some pro-social activities, really anything that they need. You know, they're there to help with. A lot of our clients are here in our community. They don't have licenses or birth certificates, and so it's very hard for them to access services. So we'll start there. It seems really basic, but you can't access a lot of things if you don't have identification, and so we do a lot of that work as well. So again, if you all have anyone that you are concerned for, we can talk about how you can make an outreach referral for that program. Another program that we have is our forensic program. So that works with people that come out of the Justice Center or Jamesville that have mental illness. They work really closely with our case managers to make sure that they're successful in the community and they're monitored as well. So a lot of people think that, people that are in the justice system is just a matter of criminality, but 2/3 of the population that are currently at the Justice Center have a mental illness, which is really unfortunate, and that's where they're being held, where they should be probably in hospitalization. And lastly, crisis services. So I love crisis. I know that sounds really bizarre, but I love being able to support people when they're at their very, very worst, to be honest. I used to supervise the mobile crisis program through an agency called Liberty Resources. I don't know if you're familiar with that. But it's the only 24-hour, 7 days a week operational mobile crisis team here in Onondaga County. I'll talk more about them in a second. Do you want to do the slide, Kirsten? So just to give you some context, Mobile Crisis is a program that actually is mental health professionals that go to people when they're in crisis, right? And so what we have a history of here is prior to Mobile Crisis, which is fairly new. I think the first Mobile Crisis team started in 2021. There are mobile crisis teams in all 5 surrounding counties, so Cayuga, Madison, Cortland, Oswego, and Onondaga. Some offer per diem, so meaning that they don't operate 24/7, they only operate specialized hours. But we're gracious enough in Onondaga County to have teams that operate 24/7. So the CNY Crisis Network is something that I started back in 2021 when Mobile Crisis was kind of up and coming. You can see all of our partnerships. So, well, actually, you can kind of see all of our partnerships. But they include, we have 3 different agencies providing mobile crisis now, so they involve all those teams. CPEP, which I'm sure you guys are familiar with, that is our psychiatric emergency room here, the only one in the area. We now have the Intensive Crisis Stabilization Center, which I'll talk more about. It's a really great facility run by Helio. And that more so operates as like a urgent care more than for psychiatric. Anyone can go there for up to 23 hours and 59 minutes. So I know it's just they can't stand more than 24 hours. But it's really nice. It's much more calming, a totally different atmosphere than CPEP, which can kind of be chaotic and busy and all kinds of things going on there. But I'll talk a little bit more about that. Our CNY Crisis Network also includes the Department of Health. We have opioid overdose team that actually goes out when someone does overdose and support the family or friends or people that are around that person and that person as well. And Contact Community Services. So Contact Community Services is a local company that actually triages all of our crisis calls. They do telephonic response. So if someone's just having a really bad day and they want to talk, they can call up Contact, and there's a trained mental health professional that can speak to that person over the phone. Go ahead. So these are our core values. I won't read through them all, but these are the things we try to practice as a crisis network. We want to be unified, transformative, a force that removes stigma and ensures 24/7 access to compassionate crisis care and support. One of the things that's really hard in crisis work is continuity of care. You know, making sure that people are served in a way that allows them to continue with treatment, right? We think of crisis as acute service. We see them just for a short amount of time. And so what's really important is that we work all together to ensure that these people get follow-up services and outpatient services and things like that. And so that's why we come together to really talk about trends and things we're seeing in our communities, people that are high utilizers of crisis, people that utilize the 911 service. You'd be surprised at some of the 911 calls. I sit up at 911 a lot of the time, and people call for all kinds of reasons, right? And some people utilize 911 for constant care and to have someone show up and spend time with them. I know. But we identify those people and we try to provide them with services as well. Kirsten? Yeah. So our mission is to ensure consistent, compassionate crisis response through someone to talk to, someone to respond, and a place to go. So I'm going to talk more about all those things in just a second, but we want to make sure we're delivered in a cultural, humble, person-centered, and supportive way. So some of the ways that we all come together to collaborate is through a monthly meeting up at the 911 Center. And what we've been trying to do for quite some time now is create a fourth response. So when someone calls up to 911 and they're actually having a mental health emergency or a behavioral health crisis, we can actually dispatch a mobile crisis team, not law enforcement, not a very expensive ride like an ambulance that they just don't necessarily need, or fire, So we are weeks away, very excited, to having a person in crisis coordinator up at 911 24/7 that's going to listen for calls that come in and dispatch directly out of 911 a mental health professional. We work really hard and closely with law enforcement, but we know that that's not the best response for people that are struggling. And for a really long time, they were kind of the catch-all, right? They're the people that always showed up. And so I work really closely with Syracuse Police Department to ensure that they're going to the calls and they're keeping the community safe. But mental health professionals are the one responding to people that are in crisis. And so I'll talk, again, a little bit more about that later. We also, crisis services is throughout the lifespan. So anyone can call mobile crisis. You can be 13, you can be 73, it doesn't matter. And so we also want to make sure that the Onondaga Children's Crisis Response is a focus of ours too. So we come together with our mobile crisis teams and Access Services, which is a pretty popular children's program, so that work with students and youth a lot, especially in the Syracuse School District, to ensure that they're getting the services and the support they need. And so we come together and we look at, what children utilize crisis services this month, and do they have the supports and services that they need? And then we just don't want anyone to kind of fall through the cracks, especially when it comes to the youth. Go ahead, Kirsten. So this is kind of an interesting thing. One of the things we just did, I keep showing the slide, and I haven't asked anyone permission if they care if their picture is being broadcast everywhere, but you can hardly see them anyway. So if you could see them, you'd see that there's an eclectic group of people here. We have Marla from NAMI's there. We've got our mobile crisis leadership. We have the Sheriff's Department. We have the Syracuse Police Department. We have Contact Community Services. We have the Department of Health. All these people came together to really look at our crisis system here in Onondaga County and see, where is it working? Where is it not working? What are the gaps? And this lovely group of people from Rochester came and actually ran the event for us. And as you can see behind them, you see all those papers back there? It kind of looks like this, right? These are all of the services back there, right? And a lot of people, unfortunately, either don't know them or don't know how to access them. Kirsten, do you want to do the next slide? So this was the process. So the process helped Onondaga County map out emergency response when someone experienced a crisis. The crisis response system mapping exercise is a valuable tool for identifying each stakeholder's agency's role within the larger system and to identify strengths and challenges within the system. Next slide. So this is our system, right? It shows how people come into the system and how they leave the system. It shows all the different crisis hotlines and warm lines, the crisis respite centers we have, our mobile crisis teams, all the law enforcement agencies, which you can see there's a lot in Onondaga County, and that can make things very complicated when we're trying to promote crisis intervention training for law officers and things. It shows all of our criminal courts, all of our different, we have 5 or 6 different paramedic, responses here in the county. And so it's just a very complicated system. And it shows all the ways people can come in and out of it. These were some of the identified strengths that we were able to identify as part of this event. Is there any way I can take this off? Oh, so much better. Okay. So I'm sure a lot of you are familiar with NAMI. Anyone familiar with NAMI? Yep. Okay. So we work really closely with NAMI. We do a couple trainings a year with law enforcement in crisis intervention training. So if, unfortunately, they do have to respond to a behavioral health crisis, they're trained in some ways of de-escalation, some ways of communicating with people who have severe mental illness, including schizophrenia and psychosis. And so NAMI's a big part of that, right? And NAMI does a really good job of letting their families and friends know about the crisis services here. We have a strong presence of mental health first aid training. I think you guys, did you do something along? No, you haven't? Okay. I recommend that if you have an opportunity to take that course or have someone come here and do that, it's an amazing thing. You learn a lot of good strategies. You learn a lot about mental illness. in how to interact with someone who's struggling or symptomatic. So, get a hold of me and I can give you more information about that. Our county's website actually has a lot of critical information on the services in our system, a lot of the ones I talked about. You can just get on Onondaga County and go to crisis services, and there's a list of all kinds of things on there. I also brought a cheat sheet that I'll go through later. You guys are welcome to grab one, and my business card. So if you have any questions or you need to email me, or you have someone that you're concerned about, you can just, shoot me an email. We have a suicide prevention task force that does a lot of things here in our community. Chalk the Walk, if you've ever heard about that. That raises the concerns and trends we're seeing right now in suicide ideation and suicide in our community. We now have the Syracuse School District has a crisis response team, their own team that actually goes between the buildings. We were getting lots and lots of calls, unfortunately, to school districts that either didn't have trained staff, were having multiple crises going on. And I had to work really closely because they were calling law enforcement a lot of the time. And I had to say, probably not great for an 11-year-old to be in the back of a cop car when they're having a behavioral health crisis. So let's not do that. Okay, guys. So they have their own now crisis response team, and they do utilize mobile crisis sometimes. But we've tried to improve the processes around that. The Department of Health has certified peers to reach out to people with substance use disorders, and we have a variety of crisis reports available for community for mental health and SUD. So these are some of the lines, and I don't want to make this complicated, but I'm going to try to simplify it as easy as possible. And again, I have everything up here so you guys can reference it or bring it home. Or we have the 988 National Suicide Prevention Hotline. I'm sure you guys have heard about that. 988 is local here to our community. The tough thing about 988 is if you have a different area code, right? It's not geolocated like 911. So what happens sometimes, like with college kids, if they're here, but they're from a different area, if you call 988, it's going to go to your local 988. They'll transfer you, they'll get you where you need to go. But I think of 988 as really just focused on suicide prevention. They'll, if you're feeling suicidal or you're having some suicide ideation or you're just, whatever the circumstances may be, they have trained mental health professionals that will help you, assist you with that, talk with you for a while. If you need an in-person response, they'll get you where you need to go. But I'm going to talk more about the lines to call if you're with someone that's in crisis and you need someone to come to you. We have a local hotline number. We call this like a warm line. This tends to fall more in like the range of people talking about their day, job stress, looking for connection. That's through community contact as well, our local triage. And yeah, it's just a lower acuity line, something that isn't necessarily urgent. Everyone's definition of crisis is different. What your crisis may not be a crisis to me. And so we try to follow an acuity scale that helps us understand just because you're in crisis and you're not, presenting in a certain way doesn't mean that you're not in crisis. So 211 is a free service here. It connects callers to critical health and human services in their community. So if someone needs to know where the local food pantry is, shelter, it's kind of more of an informational line, not really for crisis. And then Crisis Connect. So this is the line that's going to get you a mobile crisis team. It's available 24/7. You can access their telephonic services. You don't necessarily need to call there if you need an in-person response or you think you do. But they will connect you with one of our 3 mobile crisis teams. And they will, we'll talk about kind of what that call will look like or feel like. But that's the 24/7 line. And then for a health, like an SUD crisis response outreach line, this is available only during certain hours, 8 to 7 p.m. weekdays. Connects callers to trained peers if they do not want to have anyone respond. So that's the line. So if you know someone who's either experiencing an overdose or recently has and needs some support, that's the number that they can call. And of course, all lines are open to anyone of any age. Kirsten? Yeah. Mm-hmm.
That's a lot of organizations. If I was in crisis or I had someone who was in crisis in front of me, I would call 911. That's the only number.
Exactly why we did what we did. That's why we moved to having a mobile crisis dispatch now through 911.
Okay, so if
Yep.
I called 911, what
Now.
would happen?
So if you call 911, you'd get a call taker. That call taker would code the call a person in crisis, right?
Okay.
It's just how they do it at 911, depending on what the caller was saying.
Whether it was an overdose or a mental crisis or,
Yep.
okay.
And so based on the level of acuity, if you need help right then and there, they're going to send law enforcement. Or they can get there faster. They can just get there faster, right? Now, we have two options. You can just get a mobile crisis team that's dispatched to wherever you are, or we have now we call a 250 unit, which is law enforcement and a mental health professional driving around together. That one's going to get you a little faster than just the mental health professionals because they don't have lights and sirens and they have to obey all of the traffic things. So it depends on the level of acuity, but if you call 911 now and you're in crisis, that's an option for you.
And all of this is funded still and will continue to be funded?
Yep. So we got a grant from the city that is supporting contact and providing those crisis counselors up at 911. We have been up there from 11 a.m. to 7 p.m., but obviously we were missing a lot of those calls that were happening after those hours. So now we've switched to 24/7. Yep. Substance use. Yep. Yeah, substance use disorder. So you're right. There are a lot of numbers, and it's hard because different providers provide different crisis services. That's why I suggest that this is one of the numbers where you can get any of the mobile crisis teams, 315-251-0800. But again, the three providers of mobile crisis services are Helio Health, right? So they can actually assist with transportation. Transportation is a big issue here in our community in terms of people that are in crisis, getting them where they need to go, if they need to go to the hospital, or if they need to go to CPAP. It's not, they may not fit the acuity of an ambulance, and that's very expensive, but how do we get them to CPAP if we need to? So Helio Health can assist if the person can be safe. They'll get them to where they need to go. And they're affiliated with the Intensive Crisis Stabilization Center. So that's the psychiatric urgent care that's located in Helio. It's a very calm, collective place. They can do medication. They can do crisis counseling on scene, and they serve children and adults. So definitely, we can talk more about that, or I can answer any questions you have. Liberty Resources Mobile Crisis Team, 24/7 in Onondaga County. Again, you can just call this number. They'll talk to you, and then they'll come out and assist you with anything that you need. St. Joseph's has a mobile team too. That one obviously is associated with the CPAP. They're available 7 days a week, 7 a.m. to 11 p.m., Monday through Friday, 7 a.m. to 7 p.m., Saturday, Sunday. They have their own line that goes directly to them. So I don't know, but you can also access them through that 251-0800. St. Joe's team, a lot of the mobile crisis responders are registered nurses, so you have that added level of expertise. But again, 911 or this number, you don't need to know the hours of operation. They know the hours of operation. They're going to send someone to you, so don't worry about having to know that. And then we have the Onondaga County Department of Health SUD Crisis Response and Outreach. This is the one if someone is overdosed on a substance. You can change it. Oh, okay. One of the nice things about a mobile crisis response is that they can do follow-up. So they come out, they help with the crisis. What they're to do is they're going to check on that person in a few days or the next day, right? They're going to call them up. They're going to go back out to the home, visit with them. They're going to make referrals for outpatient services and things. And so that's the continuity of care I was talking about in terms of not just helping them in that moment, but helping to make sure that they don't ever have to hopefully use a crisis service again. So, and they can assist with warm handoffs. So they can help if someone does need to go to the hospital or the ICSC, the Intensive Crisis Stabilization Center, or CPAP or an ED, they can ride along, they can follow behind you, they can talk to the provider when you get there. They can just help make that pretty chaotic and complicated process go a little bit more smoothly. What to expect when you call a mobile crisis? Well, you're going to talk to someone who's just going to ask a couple questions to get an idea of what's going on. It's good to have a name and date of birth. You don't have to have a name or date of birth. We have lots of people who call and just say, I'm on Montgomery and there's a person here who looks like they're in crisis, and can you please come? I'm on the corner of Montgomery and Madison. I don't know this person's name, but this is what they're wearing. And we get those calls, and then we get really detailed information calls. But obviously the more information you have, the better. Sometimes it's nice to say, I really want someone to come to me, or I just need to talk to someone, because then they know kind of what you're looking for. You can identify if anyone has self-injured. That means there's an added element of we need a paramedic immediately. The nature, so what's going on, what's this person acting like, saying, what does it look like they're just experiencing or thinking? What is the current involvement of the caregivers, parents, or guardians, or people that are around this person? And has anyone else been notified, right? So, if you're with a family member or a child and the caregiver isn't there, they don't need to give permission to have mobile crisis come, but we would like to know if this child's parent is aware of the crisis. Again, I think, is this going to go out to everybody too? Can everyone? Okay. So here are just your 2 crisis centers. So the Helio Health Intensive Crisis I can't talk today. Stabilization Center, the address, the phone number. They have 24-hour service, including detox, medication bridges, and counseling. CPAP, same thing. They also have a medication fast track. So this is new. This is a space separate from CPAP, but also allows people to go 2 days a week from 8 a.m. to 6 p.m. just to get med refills, right? Bridge prescriptions, long-acting injectables if they have something like a schizophrenia and that's what they're taking. What's nice about this is that you can just walk in. You could be any age. If your provider has a long wait list or you can't get into your doctor and you need meds, that's the place to go. And you're not having to go through the process of getting admitted to CPAP, right? It's quicker, it's easier. And then, of course, Upstate Golisano Children's Hospital. That's where we send all our kiddos when they're in crisis. Again, typically we're trying to do that with either a parent, guardian, someone other than law enforcement. So law enforcement, especially now in the city, is not transporting people in behavioral health crises any longer, for good reason. Any age, up to 18. Yeah, sorry, yep. Oh, it's very traumatic. Yeah, it's to ride in the back of a police car, and I have, but for good reason. It's not fun. Often you have to be handcuffed. You're in a cage, essentially. Yeah. Yep. All right, so this is a little bit of what I talked about earlier. So this is the 911, what we're doing. All calls, even those of non-emergent nature, pass through our 911 center. Our 911 center, I don't know if you guys are familiar, it's up near OCC. They do a really, really good job up there. And so this was old, so our contact has embedded a clinician in the 911 call center. Was just 11 to 7, but we're moving to 24/7, which is going to be really nice. When is that? 2 weeks, I think. Yeah, they're just finishing up the training. So we had to hire and train up and everything. The person in crisis coordinator is going to be embedded in the 911 center, available 24/7 to triage and direct calls to mental health response teams to employ the appropriate level of response. This will increase the likelihood that individuals who truly require emergency level medical or psychiatric care are directed to those services more quickly and appropriately. I talk really fast. Questions?
Hello. Lots of resources here. It's great, and I love the coordination. It's wonderful. One I'm wondering is if there's a particular organization or center that focuses on LGBTQIA youth in particular, or have expertise in that area where they're kind of getting pulled in for that type of work.
I don't know if there's one that is just specific to youth.
Yeah.
I don't know of one.
I'm also just like really heightenedly aware of the fact that the federal government is cutting funding towards that type of work. So I kind of want to make sure it's focused or continue to be centered in Onondaga County.
Yeah.
I know HCR Health has, I think they do some crisis work. I'm not quite sure.
They also got a portion of their funding cut because
Yeah.
That's why I'm thinking.
But
Yeah.
people know them to be what they are, and so people are still coming to them.
Okay. Thank you. This is good too. So when we look at, I don't have that much control over budgetary stuff. unfortunately. But what's nice is like if you take my card and you guys see gaps and things in terms of mental health services. I also don't live in the children's world very often because I do adult, so that's why I take responsibility for. But yeah. Yep.
Andrea, these services, do they actually work? They work with people who are in crisis, but do they work with the families also?
Yeah. So this is just the mobile crisis teams. The numbers that are up there that aren't on here are the hospitals, like the emergency rooms and the CPAP and Helio. But I think this is going to be provided for you all as well after.
Yeah. Tom is recording this so that it can be sent out, so you will have access to the things that are here. And if you call us at the county,
Yeah, I'll give you my card too.
we can provide you those numbers also.
Mm-hmm.
So families, Andrea.
Oh, families, yes. So that's part of our follow-up process. So if there's an individual in the family that ends up in crisis and utilizing mobile crisis support, we will follow up with everyone that is needing support, right? And that includes the family. In a lot of our situations, we realize that a lot of the care that comes after that is from the family, and they need to be on the same page in terms of like being on board with what this person needs. And so we make sure with permission, right, with release of information, we can reach out and pull on those formal supports or informal supports. So. Mm-hmm.
I work in my father's kitchen, and I help with the medical care, and we often run into people in crisis at different levels of crisis mentally. And if we give you a call at one of these numbers, you'd be able to come
Absolutely.
within a 15-minute time. Or
Well,
somebody.
so yeah. Again, they don't give us sirens and things,
Yeah.
But we have multiple teams, right? So if one team is busy or on a call, then they'll send a different team from a different organization. If everyone's busy, it may be a bit of a wait. It just depends because we cover the entire county, so there's that. If it's a high acuity call, they'll just send a paramedic or law enforcement. But again, I've been working hard to really train up law enforcement in some of these critical situations so that the person that responds has some level of understanding. So. Okay.
The other question I had was, do you folks respond to situations where there are a number of people in crisis because of a traumatic event?
Yep. So we have a community crisis response team. So like we've had unfortunate, when a student passes away, we'll go into the school and provide supports. When the officers were killed in the line of duty now almost 2 years ago, we stationed up at SPD and we were there all the time.
Right.
So I can provide you with that.
Yeah. My husband's part of the community response team. I think it's the same one, unless there's another one.
Yeah, I mean, I don't know all the members because people kind of volunteer their time, right?
All
They
mental
go there.
health providers on the team. Okay.
Yep. So.
All right. Oh, that's good.
Mm-hmm.
Well, thank you.
Yep.
I just wanted to thank you for training the police officers because about 7 years ago, one of my daughters had a mental breakdown near Krause Hospital, and we are upstate, and the police came. She was out of control, and they pinned her down on the sidewalk. And the trauma of her experience by the police, who they were doing what they were trained to do, is still with her today.
Yeah.
And so thank you you get it. And if you don't get it, we want them to be safe, but in order for all the parties to be safe, you have to use some. She wasn't dangerous.
Yeah.
But they didn't know that.
Yeah. Yeah. They're there to keep us safe. They're not there to, and to keep themselves safe, so.
Is it on? Oh, yeah. So I am fairly new to the church. I am a transplant from New York City. My family member, who I'm deeply concerned about, still continues to live in New York City with my mother. And I'm wondering, is it better for them to move up here, considering that all that, Onondaga, upstate has compared to New York City, which you can kind of get lost in the cracks, and I feel like he has. Would you recommend that, or?
Well, without knowing anything about the situation, I don't want to make a recommendation.
Yeah,
But
fair.
yeah, I mean, what think is great about Syracuse, and I think this could be a point of contention for some, is that we're very resource rich. We just don't talk to each other, right? And we don't do a great job of marketing ourselves. And so it's the hard thing to market is the 911 center. Call it So if I could put a big billboard up on 690 that had all these numbers on it, I would. But then we get into the politics of different providers and agencies and how they market their phone, so all the stuff. So I would say, yeah, I mean, we're lucky. We have the only psychiatric emergency room in the area. I mean, the next place is Rochester, yeah, I mean, we do have a lot of services, but a lot of those services are being used. I mean, we have wait lists. Right now, our profession is struggling in terms of staffing. We are housing providers. We want to be able to move people into housing, but they have, shortages in terms of who's working for them and getting people hired to make sure that these people are safe. So there is a lot of that. But, I mean, I don't know where in New York City. I did spend some time in the city. What borough or anything, but they do a really cool thing that I tried to do here, which is they have their mobile crisis rides around with paramedics, like ambulances. I tried that here. I think we did it for about 6 months, and AMR was really supportive of it. The problem is that they only get paid if they do a transport, right? So people were not getting transported because we were doing our job and they got to stay home and then they weren't getting paid. So it's like, they were like, this isn't really supporting our agency. So hopefully the law's changed, in terms of that. But yeah, I mean, you take my card and we can talk more offline. Yeah.
Please, thank you.
Yeah, of course.
Also, I'm so sorry. So I live in Red Creek.
Oh, yeah. I didn't mean it like that, but that's a hike.
No, it's totally understandable for those people.
Is it Onondaga County or Oswego County?
Actually, it's Cayuga.
It's Cayuga County.
And that comes to my second question, which is, I love the programs, but would my brother be able to utilize the programs even though we live in Cayuga?
So Cayuga's mobile crisis team, I actually used to oversee. It's a great program. I'm not just saying that because I used to oversee it. It really is. But it only operates 5 to midnight, right? So it's one of those counties that has limited hours.
Right.
Cayuga Counseling in Auburn is fantastic. They do a really, really good job. And actually, I think that they just started a mobile crisis team out of their clinic that works during the day. So there are services. Most of them are in Auburn, but yeah. So.
Okay.
And there's a lot of transitional services out there because of the jail, the prison. So, yeah.
Right. Thank you very much. Thank you.
So I wanted to just share a little bit about why Andrea's here. We have been working, and if you were around this summer, we had 2 trainings. One was Mental Health 101, and the other one was on de-escalation skills, and we had Access CNY's training team here to do those. And we are trying to address internal and external connections with people in ways that we can be a welcoming community and also be supportive. And, we're talking about mental health here, and safe, thank you. And I did talk to Andrea a little bit before, but, we get situations here that can be kind of scary. And in a way traumatic, because this is a safe place. We want to welcome everyone in. We want to be loving and open to people being here. And even our own selves in this church community, not people coming in from the other communities. This community, we have mental health people here. Not all of us have skirted away from the mental health programs and crises in their lives. And so some of us need more support internally, and I would really love to see us be a more understanding church about who we are as people in this community and welcoming people from outside to come in.
One of the things I say that makes it really complicated, I know I only have a few minutes left, is that a lot of the people that we're experiencing, especially our unhoused population here downtown, is that they're struggling with multiple things, right? They're struggling with substance use. They're struggling with mental illness, right? They're struggling with intellectual developmental concerns and things that are very much untreated, right? And so it's this mixed bag of things that are going on, which make it very, very hard for these people to be successful, unfortunately. One of the things I start with when I train law enforcement is this idea of their reality, obviously very far different from what they're actually coming into contact with. But it's almost like me trying to explain to you that your arm is broken. And you're telling me my arm is not broken, right? And nope, you have a broken arm. And this person's like, no, I don't. I'm not going to go to the hospital. I'm fine. I don't need to do this. I don't need to do that. And so there's a very fancy term for that. But I would say a lot of and I won't try to say it because I always mess it up. But that's what we deal with. I mean, those are the people that you're probably coming into contact with in the community, is that they're not convinced that they're ill. And so just daily interactions with them are very tough. They're very much, their reality is their reality, right? And there's no convincing them that there isn't, unfortunately. And so, a lot of the things when we do scenario training, which I won't do with all of you today, but it's a lot of fun, is, what it looks like to come into contact with this person. And then also, understanding that they're not in touch with reality, unfortunately. A lot of them have a lot of internal stimuli. So they're hearing things constantly. And so you'll often see them having conversations. You'll see them responding to that stimuli that we can't hear. And it's very hard to reach those people, talk to those people, help those people, but that's what they're experiencing. And so it's just a tough thing to navigate. And it can feel very scary. They don't mean to be scary. They just don't. They're living somewhere different, right? They're not, and I'm overgeneralizing here, and that's not everyone that is struggling, but for a large part, that's kind of what is going on. So.
But one of the things we also deal with here is that many of the people, of course, as you mentioned, do not have a home. They don't have a place to lay their head or go to the bathroom. Mm-hmm. And so we've tried to talk to the city about the opportunity for them to provide some facilities for people, because it's a slap to their dignity that they don't even have a place to go to the bathroom. Have you worked on that issue at all, or would you be willing to work on that issue?
That is a big city council situation.
Why?
Well, I think so. What we're also dealing with is city businesses, right? And they have a big say in, their business being successful. And so we've talked about having facilities, bathrooms, showers, water stations. But the problem becomes who takes care of those places, who pays for those things, where do they go, how can everyone access them? I mean, we've got the men's shelter way down on Erie Boulevard, we've got the women's shelter. I mean, we've really got things spread out for different reasons, right? And so there is an organization that, oh my God, I can't even think of the name of it now. It does provide laundry, showers, bathrooms. Yes. I was just there the other day. Yeah. They have a clinic. They have dentistry.
It's a Emmaus clinic?
Yeah.
It's amazing. I've helped out with them over the years too. But they have a couple showers. They have a guy, anybody can come in, and they may have to wait in line on the day that things are being offered, but they provide free shower, scrubs to put on while your clothes are being washed and dried, and some clean clothes if you need clean clothes. And there's meals every single day there, so it's amazing. But it's pretty far down on the south side.
It's not centrally located.
And I think there's some other places too. I can't remember where they are.
Yeah. So there are organizations that are doing this privately, and yeah.
So let me mention a meeting that I was invited to a week and a half ago. Catholic Charities is looking into the possibility of a mobile toilet and shower van. There are legal complications for putting that on the street, but it is an option that is seriously being looked at right now. And this was a conversation that particularly was aimed at those of us who inhabit East Onondaga Street, because it is a thoroughfare from the shelter to the Samaritan Center. So keep your ears open. We may have some good news down the road.
Yeah. I think when it comes to the city doing that, I don't think that's in the cards. I think organizations are probably more likely to be successful at that. I know.
There is the Center for Community Alternatives on Jefferson Street. If you meet the criteria for coming in there, a lot of these are daytime programs for people who are in the community. There's Access CNY has Unique Perspectives, which is on Salina Street. There is the Helio Health Recovery Center, which is on Hickory Street, and Center for Community Alternatives on Jefferson. But they do have showers and they have changes of clothes. They have ability to, do your laundry and that kind of thing. There is also another new program that's a daytime program. It's called Devon's Rec Room, and this is built on activities and built bodybuilding and mindfulness and yoga, and it's just a really nice place to go. If you want to go visit, just let me know and I'll give you Henry's information, or just call up and say, hey, I'm interested in what you're doing there. So anybody who's been sober for 24 or 48 hours is welcome. That's the Oasis rules. So anybody who's been sober for that period of time, welcome to go there. They have a couple of trainers. They do all kinds of really great stuff. Anybody?
No? Well, thank you so much. I'm sorry I talked so fast. Grab my card, grab this little mobile crisis cheat sheet, and if you need anything, email me, call me. Thank you.